Next, let's discuss what this condition is. Acute cervicitis is an inflammation of the cervix, predominantly caused by sexually transmitted infections. The two most prevalent pathogens responsible for this condition are Chlamydia trachomatis and Neisseria gonorrhoeae. These infections are especially common in women under 25, making it a critical area of study for those entering the medical field. The pathophysiology involves these bacteria invading the cervical epithelium, leading to inflammation and an immune response that manifests as discharge and bleeding. Moving on, let's talk about symptoms and clinical presentation. Patients with acute cervicitis often present with postcoital bleeding and a thick, mucopurulent discharge. These are the hallmark symptoms that should raise suspicion of cervicitis. Other, less common symptoms include dysuria, dyspareunia, and vulvovaginal pruritus. Interestingly, in pregnant patients, cervical motion tenderness, a typical sign of ascending upper reproductive tract infection, is often absent. This is due to the protective mucus plug that seals the gravid uterus, maintaining uterine sterility. Next, let's discuss diagnosis. Diagnosing acute cervicitis primarily involves clinical evaluation. On pelvic examination, a friable cervix that bleeds easily upon contact and the presence of a malodorous, mucopurulent discharge are significant indicators. For confirmation, nucleic acid amplification testing is performed to identify the causative organisms. Given the potential for severe obstetric complications like spontaneous abortion and preterm pre-labor rupture of membranes, empiric treatment is recommended while awaiting test results. Now, let's move on to management and treatment. The treatment of acute cervicitis in pregnancy involves empiric antibiotic therapy to promptly address the infection and mitigate risks to both the mother and fetus. Ceftriaxone and azithromycin are the antibiotics of choice, effectively covering both Chlamydia trachomatis and Neisseria gonorrhoeae. It's important to note that doxycycline is avoided due to its teratogenic effects. Management also includes patient education on preventing future infections and the potential need for partner treatment to prevent reinfection. Consider the case of a 23-year-old pregnant patient who presented with postcoital bleeding and a thick yellow-green discharge. On examination, her cervix was friable and bled easily. Suspecting acute cervicitis, the clinician initiated empiric treatment with ceftriaxone and azithromycin while awaiting nucleic acid amplification test results. The tests later confirmed the presence of Chlamydia trachomatis. The patient responded well to treatment, with resolution of symptoms and no further complications in her pregnancy, illustrating the importance of prompt empiric management. In summary, acute cervicitis in pregnancy is a significant condition that requires early recognition and treatment to prevent serious complications. Key points include identifying the characteristic symptoms, understanding the diagnostic process, and initiating appropriate empiric therapy. Early diagnosis and management are crucial in ensuring positive outcomes for both mother and baby. To reinforce your learning, we encourage you to engage with our pre- and post-podcast quizzes and utilize the Anki flashcards we've provided. Thank you for joining us on Med Madness, and stay tuned for more insightful episodes.